Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bengaluru, Bengaluru. Today, let us discuss on the most common problem that I see in my day-to-day urological practice, the problem of urinary tract infection. Specifically, let us discuss on recurrent urinary tract infection. Recurrent urinary tract infection are almost always seen in women, even though they may be seen in men also, but they are rare. Many women suffer from urinary tract infection and some amongst them suffer from repeated urinary tract infection. What are the symptoms of urinary tract infection in a female? A woman will visit a doctor with complaints of burning sensation while passing urine, pain in the lower abdomen, low back, increased urinary frequency, urgency in passing urine. Sometimes there could be a leakage of urine when the urgency is so severe that she cannot reach the toilet on time. Some recurrent urinary tract infections could be associated with fevers and chills also. There could be vaginal itching and sometimes foul smelling urine. All these symptoms indicate urinary tract infection. Diagnosis of urinary tract infection is very simple. The doctor will carry out a urine examination that is called urine routine and microscopy test to diagnose it. It will show lots of bacteria, lots of pus cells and some other tests in the urine which are positive. Once a urinary tract infection is diagnosed, the treatment is straightforward by giving antibiotics. But since here we are talking of recurrent urinary tract infection, there will be some change in the treatment modality. Before we go into the treatment, the question that everyone asks me is, why do I get repeated urinary tract infection? Well, the answer is, most of the time we don't know the cause, except that they occur in female. So gender itself is a major predisposing factor for recurrent urinary tract infection. In a very small proportion of patients, the following could be the cause for recurrent UTI or urinary tract infections: extensive traveling, dehydration, use of public washrooms, lack of sleep and rest. All these things, they bring down the body immunity and predispose to urinary tract infections. However, as we are talking of recurrent urinary tract infections, most of the times we just don't find a cause. So we are left with a modified treatment for recurrent urinary cause infection. In an infection which occurs once in 6 months or 1 year, we just give a course of antibiotics and do nothing after that. In recurrent urinary tract infections, it could be frequent course of antibiotics, or we also adopt a strategy where we give low dose long-term antibiotics, or we instruct the patient to do a self-start therapy wherein the patient, the moment she feels she is going to get urinary tract infection, starts the antibiotic herself. So there are various modes of treating recurrent urinary tract infections, and once you go to the urologist, he will be able to guide you as to which is the best way to tackle recurrent urinary tract infections. Another question that is asked is, what can be done to avoid recurrent urinary tract infections? Many women say that they drink 8 to 10 glasses of water per day. They do some dietary changes. They take cranberry juice or cranberry capsules. They stop using public washrooms, etc. Or they indulge in a different menstrual hygiene like menstrual cups, etc. However, the truth is, it is very difficult to prevent recurrent urinary tract infection because, as I told, we don't know the cause. So we are left with an effective treatment for urinary tract infection, but unfortunately no cure. But even an effective treatment for urinary tract infection changes the life of the patient from suffering to a normal activity. So that is the importance of diagnosing recurrent urinary tract infection and treating them effectively. Thank you.